Next, we have the College of Family Physicians of Canada, Christine Campbell, Family Medicine Resident.
Hi. I would like to thank you first for inviting the College of Family Physicians of Canada to discuss the Act from the perspective of family physicians. The CFPC represents more than 37,000 members. It is a professional organization responsible for the training, certification, and lifelong education of family physicians. The CFPC accreditates postgraduate family medicine training in Canada's 17 medical schools. I am Dr. Christine Campbell. I'm a first-year family medicine resident working through Dalhousie University in Prince Edward Island, and I hope to open my own family medicine practice next year after completing my training. I should note that the majority of the work done by that the college has produced addresses the use of dried cannabis for medical and treatment purposes rather than for recreational use. However, many of the findings that I'm going to list today remain relevant for considerations of recreational use. Research shows that dried cannabis is a potent psychoactive substance and can have serious acute and chronic cognitive effects.
Back away a little bit from the microphone.
Okay.
It'll pick you up.
Is that?
It's okay. You can just leave it here.
Okay. Symptoms including drowsiness, disconnected thoughts, dizziness, altered mood, potential for long-term serious adverse effects including psychosis. Cannabis use disorder might be as common, appearing in 1/5 of regular users. This is more commonly seen in males, those who start using at a young age, and those who use frequently. Cannabis use causes acute physical effects, including high blood pressure, rapid heart rate, and release of stress hormones, including adrenaline, catecholamines, and other stress hormones. There have been various reports of young people suffering heart attacks shortly after using cannabis. Chronic use of dried cannabis has been associated with persistent neuropsychological deficits even after periods of abstinence. Heavy cannabis smoking may be an independent risk factor for impaired lung function, chronic obstructive pulmonary disease, bronchitis, and cancer. Substance dependence, although lower for cannabis compared to other substances, is around 9%. This compares to nicotine, which is about 68%, cocaine 21%, and alcohol 23%. Problems which affect cognitive and psychomotor functioning and memory can impair the skills needed for driving, which can in turn cause increased motor vehicle accidents. This is an area that needs considerable more study with the pending legalization of cannabis. Research demonstrates that the health risks of cannabis increase significantly with the intensity of use, frequency of its use, and is a strong predictor of cannabis-related harm. So I would like to now discuss cannabis in youth. Cannabis is specifically problematic in users under age 25, where the brain is still developing. This population is at greater risk for the psychosocial harms of cannabis, including suicidal ideation, cannabis use disorder, illicit drug use, and mental health issues. It has been shown that the adverse effects of cannabis on the adolescent brain are more severe than the adult brain, especially with persistent use. So just a story about my residency and experience. I have to rotate through the different specialties in order to maximize training. I'm currently doing my emergency rotation, and I have been amazed at how many patients I see on a regular basis coming in with psychosis induced from cannabis, or adolescents coming in reporting heavy substance use with cannabis and reporting high amounts of anxiety, depression, and seclusion from friends and family. The CFPC urges the government to involve family physicians in the implementation of any policies related to recreational or medical cannabis. Given our role as primary care physicians and our first-hand experience for caring for patients who abuse substances. Family physicians require support to patients who might suffer adverse effects, including cannabis use disorder and harm to mental well-being. Finally, it is important to distinguish that the advice laid out in this presentation does not cover the impact of proposed legalization on society or the justice system. Such considerations are beyond the scope of the CFPC, and I would like my commentary today not be taken as one position or the other. That is a question for Parliament and for organizations and individuals with expertise in the criminal code and regulation for controlled substances. Thank you very much for your time and consideration of the CFPC's perspective on this issue. We appreciate the opportunity to provide input and look forward to ongoing collaboration.
Thank you very much, Dr. Campbell.